The first time an aging parent or loved one falls is terrifying. Even if your parent is lucky enough to survive the incident without serious injury, everything feels shaken. Hi, I'm Liz, and today we will be covering how to plan if your aging parent has fallen, brought to you by Visiting Angels. You realize how real mom's age and decline have become. She no longer feels like she can trust her own body or the ground beneath her. She worries daily about simple things like moving around the house. Because 55% of falls happen inside the home, with an additional 23% outside but near the home, the threat of falling can feel overwhelming and unavoidable. Furthermore, falling is the most prominent warning sign of further falls to come. After falling once, you're twice as likely to fall again. Physical injuries are a serious peril when it comes to falls. Falls are risk factors for fractures, concussions, broken hips, and more. According to the Centers for Disease Control and Prevention, 1 in 4 seniors fall each year. 1 in 5 falls leads to a severe injury. 2.8 million seniors visit emergency rooms each year for injuries sustained in falls, and roughly 800,000 are hospitalized. Upwards of 95% of fractured hips result from falls. Traumatic brain injuries are most frequently caused by falls. Falls are a mental affliction too. Fewer than half of seniors who fall tell their doctor, and even one fall, much less multiple, often makes seniors anxious or fearful about continuing about their daily tasks, which can then lead to increased isolation and a diminished sense of self-reliance and safety, even at home. Given the fact that one fall doubles the chance of another fall, the best time to take the issue head-on is immediately following that first incident. This may sound straightforward, but it's a mentally and emotionally stressful time for the senior and family caregivers, and it can be easy to dismiss the severity of the incident or to think it was just a one-time occurrence. Know the common causes of falls. Understanding contributing factors to the incident can help to comprehend it and move forward with prevention. To consider weakness, particularly in the lower body, medications that may cause dizziness, poor eyesight, dehydration, low blood pressure, clutter, tripping hazards like throw rugs, uneven surfaces, and poor lighting, shuffling when walking, loss of flexibility, alcohol consumption, lack of calcium and vitamin D in diet. Enlist a professional caregiver trained in fall prevention. Professional caregivers can bring an expert eye to a home to help eliminate falling hazards and to help ensure that your loved one is taking their prescribed medication correctly and exercising. Seniors are often more receptive to lifestyle change suggestions from outside pros than from friends and family, seeing it more as expert advice than criticism. In addition to providing a safety assessment of the home, a professional caregiver's regular visits can serve as reminders for activity, and in a worst-case scenario, another set of eyes checking in on your loved one. Fear of falling again is a common and often debilitating after effect of a fall. Seniors begin avoiding walking or holding onto walls for balance and looking at their feet, and any activity both in the home and in social settings. This only exacerbates the risk factors for falls. Muscles get weaker, balance and flexibility rapidly decrease, and they can experience extreme loneliness and listlessness. Emotional factors that make it significantly harder for them to be motivated to make improvements like exercise. Validating their experience and the resulting fear is an essential step. Let them know you understand how scary it must be. Once they feel heard, find fun ways to encourage activity. Even if it's 10 steps across the kitchen, every little bit helps, physically as well as mentally. If you enjoy our content, please make sure to like this video, leave a comment, and subscribe to the YouTube channel. Thanks for watching, and we'll see you next time.